Hello, my name is Matthew Gaeto.
And my name is Jake Messina, and we are brothers of the Professional Pharmacy Fraternity Phi Delta Chi Beta Gamma chapter from the Milan School of Pharmacy at Duquesne University, located here in Pittsburgh, PA.
In today's episode of Know Your Drug, we were discussing Advair, which is a combination of fluticasone and salmeterol. Advair is commonly prescribed for the treatment of asthma and COPD, which is chronic obstructive pulmonary disease, and is a very common drug for the maintenance of these diseases. Today, we will be highlighting the importance of using Advair in the treatment of asthma and COPD.
Asthma is a chronic predisposition to the inflammation in the airway within the lungs known as the bronchi, so that they are extremely narrowed. During an asthmatic attack, the airway becomes extremely constricted as the smooth muscles in the bronchi constrict and block air from passing through, thus creating breathing trouble. COPD, or chronic obstructive pulmonary disease, is a simple condition to asthma. However, in COPD, the symptoms get progressively worse with the time and are far less reversible than in asthma.
The salmeterol portion of the drug is a member of the class of drugs known as beta-2 agonists, and the fluticasone portion of Advair is a member of the corticosteroids class of drugs. Corticosteroids work by blocking the allergic response to allergens, which aggravate asthma and COPD. The selective beta-2 agonist, the salmeterol, works on the smooth involuntary muscle in the lungs. When salmeterol binds to the receptors in the lungs, the smooth muscle relaxes and allows airflow to occur more easily. Thus, the asthmatic symptoms would resolve.
Advair is commonly taken as one inhalation twice daily in order to ensure that the drug is constantly in your body working to prevent the symptoms of asthma or COPD. After each use, the patient should be sure to rinse out his or her mouth to prevent any kind of fungal infection from forming. Since Advair is an inhaled powder, Advair is available in 3 different strengths: 100 over 50, 250 over 50, 500 over 50. Only the 200 over 50 strength is indicated for the maintenance of COPD.
When first starting Advair, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include pulmonary function tests, which measure the functional status of the lungs. Blood glucose levels and serum potassium levels are also monitored at these visits. While taking Advair, it is important to notify your healthcare professional immediately if your asthma symptoms worsen while taking Advair. This side effect presents itself as excessive wheezing, shortness of breath, or trouble breathing. Some lesser side effects include upper respiratory viral infections, the common cold, headache, sore throat, bronchitis, as well as nausea and vomiting.
If you miss a dose of this medication, take the dose as soon as you remember. If it is almost time for the next dose, skip the missed dose and wait until your next regularly scheduled dose. Do not use extra medication to make up the missed dose. Some potential drug interactions to be mindful of include some antidepressants known as MAOIs. Advair should not be used in conjunction with other long-acting beta agonists such as Foradil. Caution should be used while taking macrolide antibiotics such as clarithromycin and erythromycin. Notify your doctor or pharmacist of any prescription herbal or over-the-counter medication you take to ensure there are no serious interactions with your medications.
If used appropriately, Advair has been proven effective in treating the chronic symptoms of COPD and asthma. In addition to using Advair, patients should also avoid lifestyle habits that would make symptoms worse, such as smoking. Always
remember, pharmacists are the drug experts, utilizing them to ensure you are receiving the best pharmaceutical care possible and to know your drug.
On behalf of Phi Delta Chi and Duquesne University's Milan School of Pharmacy, my name is Matthew Gaeto.
And I'm Jake Messina, and this has been Know Your Drug.